The specialty will automatically populate based on the patient's last encounter. It is still important to verify that the correct specialty has been selected based on your location. A new history panel has been added to the intake. However, we are not to be using this history panel to document any history for the patient. Simply hover over the toggle button and collapse all. Select the history and drag it down to the bottom of the list. To expand, you can click on Expand All, or just expand the only items that you need. The sub-navigation links will be updated to keep uniformity for all specialties. Documentation of vaping use has been added to EHR. You can access it through Histories, under Social, Add Edit, and it will be down the list, vaping use. This can also be accessed through the screening summary. Under Tobacco Usage. Scroll all the way down until you see vaping use. When adding or changing a pharmacy in the patient's chart, click on the demographics link, click inside the pharmacy name, and a new window will show up. On the left-hand side, search for pharmacy, click inside the yellow folder, click on New, and search for your pharmacy as normal. Within Vital Signs, there are 3 additional health promotion plans to choose from. Those are BMI plan, HTN plan, and the pain plan. For pediatric patients, pediatric growth charts for premature patients and Down syndrome are now calculated using 2013 Fenton growth chart data. There has been updates to the medication allergy section. Users can now associate severity to a reaction instead of with an allergy. Simply click on Add, choose your reaction, and choose the severity. Clicking OK will add that to the list. Within the patient information bar, allergies has also been updated to include the severity. Under Immunization tab, users can now indicate that a patient has not received any immunizations by checking the No Known Immunization History checkbox. If a patient has received immunizations, the No Known Immunization History checkbox does not appear. When creating a new immunization order, in addition to the already required fields such as lot number, expiration date, manufacturer, amount, units, route, site, and vaccine date, we have 3 additional fields that need to be completed. Those are BFC reason, funding source, and the new NDC ID. Patients that do not meet the criteria, your option will be not eligible. As for the funding source, when not eligible, private funds will be our option. NDC ID numbers should be taken from the vaccine vial, not the box, as they are not the same number in cases of multi-dose vaccines. For your convenience, you can hover over web links, click the down arrow button, and choose CDC NDC Crosswalk. The Medications Reconciled checkbox has been added to the Medications module. Regulatory standards now require oral liquid medications to be prescribed in the metric standard of milliliters. When adding these medications, milliliters will automatically populate and you will not be allowed to change this field. You will have to manually update existing oral liquid medications prescribed prior to the upgrade. Under Medicare Preventative HPI, cognitive assessment, functional ability, and tobacco usage have been updated. Under cognitive assessment, you can choose no change or change, status, method used, and most recent assessment. Under functional ability, you can choose no change, change, status, assessment method, and most recent assessment. Under tobacco, the new option is passive vaping exposure.